Starting today, travelers from China must submit a negative COVID test before entry into South Korea. Now, this comes as more and more travelers from the country have tested positive upon arrival. Our Seung-jae starts us off.
Starting Thursday, all travelers arriving from China will be required to submit a negative test result before entering South Korea. This means Koreans and foreigners boarding flights from China must undergo a PCR test within 48 hours or a rapid antigen test by a medical expert within 24 hours of boarding. However, travelers attending a funeral, on trips for diplomatic purposes, infants and toddlers under the age of 6, and those who have been infected and treated for COVID-19 within 40 days are exempt from the measure. The latest move comes as South Korea is seeing a soaring number of travelers from China testing positive for COVID-19. For instance, figures as of midnight Wednesday show that 131 out of 172 travelers tested positive, meaning a 76% positivity rate. Meanwhile, police said Wednesday that a 41-year-old Chinese national had escaped a government-designated quarantine facility for foreigners after testing positive for COVID-19 upon entering South Korea. The whereabouts of the man is still unknown. The KDCA said the man has been placed in the wanted list for the violation of the Infectious Disease Control and Prevention Act, where under the law, he could face imprisonment of at least 1 year or a fine of over $7,800 as well as deportation. In the meantime, the World Health Organization said Wednesday that China's COVID-19 data is not giving an accurate picture of the situation there and underrepresents the number of hospitalization and deaths from the disease. The remarks come as the WHO prepares to meet with Chinese scientists again on Thursday as part of a wider briefing among member states on the global COVID-19 situation. Earlier, WHO Chief Tedros Adhanom Ghebreyesus reiterated that the agency is concerned about the surge in COVID-19 infections in China and urged Beijing to deliver rapid and regular data on hospitalization and deaths there. Seung-jae, Arirang News.